Now we're going to look at characteristics of disease. So, what is a disease? Disease can be defined as an illness that affects the proper functioning of the body or the mind. Disease can also be broken down into two different types of disease: communicable disease and non-communicable disease. Communicable disease is what is passed from person to person, and non-communicable disease is not spread from person to person, but just how we live, such as environmental hazards. Now let's look at the diagnosis and etiology of disease. Medical diagnosis is the process of identifying disease, condition, or injury based on signs and symptoms present. Types of medical diagnosis can be divided into two types. It could be provisional and it could be histopathological. Provisional is just based on physical exams and clinical findings, and the histopathological is done by pathologists after examining sample tissues under a microscope. Some may ask, what is the etiology of a disease? And the answer one could be looking for is, what is the cause of the disease? So the definition of the etiology pertains to the biological science or medicine, which is the study of the cause of disease. Etiology can also be divided into three different types. It could be intrinsic, extrinsic, and idiopathic. Intrinsic etiology just means the disease caused by internal source within a person, and some examples of intrinsic etiologies include genetic disorders, certain types of cancers, and diseases that affect the immune system. Extrinsic etiology is caused by something that's found outside of the body of the individual, and this could be caused by chemicals or exposure to radiation. Idiopathic disease is disease of itself. That is, there's no certain origin, and examples of this could be idiopathic pulmonary fibrosis, So let's look at a couple of medical terminology that is associated with disease. Acute. So acute refers to a condition or disease that has a suddenly onset and short course in the body. Some examples of acute diseases: burns, pneumonia, the flu, common cold, and broken bones. Another term that we look at that's opposite of acute is chronic. Chronic is a lasting long time, maybe a lifetime. Some examples of chronic diseases include cancer, arthritis, stroke, depression, osteoporosis. Some other terminologies: signs and symptoms. So signs are objective indicators of disease that are obvious to someone other than the subject. Symptoms are subjective feelings. A patient may complain of shortness of breath, which could be a symptom of heart failure. So let's look at like type 2 diabetes. The sign of type 2 diabetes, which is objectively, will be poor wound healing. And then a symptom that a person may come in and state will be thirst. Disease prognosis. The prognosis is a prediction of the course of a disease following its onset. It refers to the possible outcome of the disease and the frequency with which the outcomes can be expected to occur. Such prognosis can vary depending on the injury, the disease, age, sex, race, and treatment.